Hello everyone, April here from Pelvic Balance. I'm answering a question today. Why do I have low back pain after birth? A lot of people have an easier time understanding why you may have pain during pregnancy, such as the weight of baby pulling your spine forward, increased strain on those back muscles, which you can still treat that pain during pregnancy, so you don't have to go through a painful pregnancy. But there are some factors why you might have that after you give birth as well. During pregnancy, our posture tends to change, so the pelvis tips forward a little bit. You typically get more of a curvature of your low back. And those changes do not go right back to normal resting position after you have the baby. So you still have these imbalances within your body that can contribute to some pain. The other thing that can happen is during vaginal birth, as baby makes its way down through the pelvis, you're going to have some shifting and changing that happens of some different areas. One of the areas is the sacrum tailbone area. This area can be more extended at times as baby pushes through down into the pelvis. This does not always go back to the normal position once again. So that can contribute to some increased pain for some people. The other thing that can happen is the pelvis itself, the pelvic bones, can shift and change. Get stuck in a certain position, and that can cause some pain in the low back. Some people point to this area here, the SI joint region, because there may be some type of imbalance within the pelvis that's contributing to that pain. Now, we also have to consider that during pregnancy, the abdominal wall has been stretched. So those abdominal muscles are weaker, and that's normal. But because of that, you have less support in the front of you, so that will often put more strain on the low back muscles. And then add to that the fact that you are doing more lifting. You're lifting baby, carrying baby, lifting a car seat. You're maybe in different positions while breastfeeding, that kind of thing. So that can also contribute to some issues with pain. Now, when you come in for treatment, those are all things that we address. So we check out the spine, we look for muscle imbalances within the pelvis and treat that. So if we find an area that's stuck, we get that moving again. The hips are another area that we have to take a look at, because sometimes there's some restriction there. And then once we address those imbalances, then the pain will typically resolve. So that's what we do with treatment. So if you have any other questions about that, please feel free to reach out to me, April@pelvicbalance.com. Thank you and have a great day.